Thank you for watching. My name is Dr. Charles Butrick, and I am a urogynecologist and founder of the Urogynecology Center here in Kansas City. Today I want to share with you some exciting news about overactive bladder. Overactive bladder affects 50 million adults in the United States. The common symptoms include urgency, frequency, urge incontinence, as well as that annoying symptom of waking up at night just to urinate, called nocturia. Medications help, and they have been the foundation of therapy for over 30 years. But less than 25% of patients stay on the medications due to poor efficacy as well as side effects from the anticholinergics, the most commonly used medication for overactive bladder. One of the biggest side effects we now more completely understand is a markedly increased risk of dementia that occurs when you've been on the medication even for a few months. It increases the risk by 46%. What that means is the normal risk of 5 to 6%. If you take this medication, it will increase to almost 9%. Not all medications for overactive bladder cause these symptoms. The American Urogynecology Society, in fact, recommends that women over the age of 70 should totally avoid these medications because of this side effect. And instead, they recommend the more advanced therapies that only certain practices can offer. That includes Botox injections into the wall of the bladder, a simple office-based procedure, as well as stimulating the nerves that control the bladder and the pelvic floor, called sacral nerve stimulation. It is important to realize that this little battery was simply placed as an outpatient procedure, and it helps not only overactive bladder, it also helps fecal control, as well as it more completely helps you to empty the bladder. I was one of the first physicians in the country to start performing this procedure back in the mid-90s. I have the greatest experience in the Midwest, having performed more of these procedures than any other physician. I'm past president of an international society dedicated to pelvic neuromodulation, have authored several articles, and have been fortunate enough to have a success rate that nearly is 100%. It's because of my high success rate and a practice dedicated to help patients with these problems that the Urogynecology Center has been designated a Center of Excellence for Neuromodulation. This new battery actually is MRI compliant, is rechargeable, and is therefore expected to last at least 15 to 20 years. So the bottom line is, call the office if you have these problems. Incontinence is never normal, and we have a practice that's dedicated to help you with problems of incontinence, pelvic pain, and pelvic prolapse. Thank you.